Hello everyone, I am Urologist Ömür Erdem Akkaya. When should drugs such as Cialis, Tadalafil and Lifta, which are long-acting drugs that correct erectile dysfunction, be used? When should they be used during intercourse? Should they be used half an hour before intercourse? This is an important question, because according to the graphs, these drugs reach their effective dose in the blood within 1.5 hours. In the studies, it is said that it starts to affect the person within half an hour, but when should it be used? Because when you look at the patient comments, some of the patients say, I felt better the next or after 12 hours. Or there are patients who say that they get a stronger effect in the 6th hour. Of course, the other medications used by the patient or the food they eat can affect this. When the patient takes the medication on a very full stomach, for example, its effectiveness may start later. Or if he uses stomach medications together with these drugs, the absorption of erectile dysfunction drugs decreases. Since absorption decreases, bioavailability may decrease. If the patient is using a drug like Cialis or Tadalafil, I think he should use it at least 3 to 4 hours before sexual intercourse. Because it reaches the effective dose only in 1.5 hours or 2 hours, and it can be affected by what he eats, drinks and his medications. He can get a good effect in 3 to 4 hours. This is not the case with Viagra. Studies have shown that Viagra starts to work in 15 minutes and reaches its maximum effect in 30 to 45 minutes. But when you use 5 mg or 20 mg of Cialis, it reaches its effective dose in 1.5 hours or 2 hours. It is not recommended to use it 30 to 45 minutes in advance and plan a sexual intercourse accordingly. There is such a nuanced difference between them. Thank you for listening, best regards.